welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Petticoat cancer. Is your sari putting you at risk for skin cancer? A tightly tied waistcoat of the underskirt traditionally worn under a sari, particularly in rural parts of India, may lead to what has been dubbed petticoat cancer, warned doctors in the journal BMJ case reports after treating 2 women with this type of malignancy. The petticoat is usually tied very tightly around the waist with a cord. The tight cord of the petticoat often leads to dermatosis related to chronic friction and maceration, resulting in dermatitis and depigmentation. In rare cases, the chronic friction may lead to development of squamous cell carcinoma. This phenomena has previously been described as Saree cancer, but it is the tightness of the waistcord that's to blame, researchers point out. The first case concerned a 70-year-old woman who sought medical help because of a painful skin ulcer on her right flank that she had for 18 months and which wouldn't heal. The skin in the surrounding area had lost its pigmentation. She wore her petticoat underneath her sari, which was tightly tied around her waist. A biopsy specimen revealed that she had a marginal ulcer, also known as squamous cell carcinoma. 80 minutes of weekly exercise helps cut baby blues. Study finds. Exercise only programs help cut the severity of the baby blues and the risk of major clinical depression in new mums. Finds a pooled data analysis of the available evidence published in the British Journal of Sports Medicine. But at least 80 weekly minutes of moderate intensity exercise such as brisk walking, water aerobics, stationary cycling and resistance training with bands, weights or body weight are needed to achieve the effects the findings show. The researchers looked for relevant studies published up to January 2024 that compared various interventions including nothing, education and standard care with exercises to treat depression and anxiety 12 weeks after and within the first 12 months of giving birth. In all 35 unique studies out of an initial haul of 1152 involving 4072 participants from 14 countries were included in the systematic review. Clinical trial reveals role of Psilocybin therapy in Anorexia Nervosa. A trial published in Nature Medicine that had shown how Psilocybin therapy affects individuals with Anorexia Nervosa. In a recent study, researchers explored psychedelic medicine's potential for treating one of the psychiatry's most challenging conditions. This new emerging topic review reveals both promising outcomes and important limitations that could shape future treatment approaches. The study published in Psychedelics offers a unique first-hand perspective on how psilocybin treatment impacts patients with anorexia nervosa, a condition that maintains the highest mortality rate among psychedelic illness and has historically resisted conventional treatments. Our findings suggest that psilocybin may be helpful in supporting meaningful psychological change in a subset of people with anorexia nervosa, says Dr. Stephanie Nadsbeck, lead author of the study. Particularly interesting is that 60% of participants reported a reduction in the importance of physical appearance, while 70% noted quality of life improvements and shifts in personal identity. Do no harm. Researchers guide doctors on what not to say to patients. In a recent paper published in Mayo Clinic Proceedings, researchers describe clinicians must engage in compassionate communication as part of the treatment process. They have identified so-called never words that should not be said under any circumstances, offer methods for clinicians to identify their own never words and provide more helpful language to use instead. Communicating the nature, purpose and intended duration of often complex treatments and setting realistic expectations about what they offer still comes up against timeless patient experiences, fear, intense emotions, lack of medical expertise and sometimes unrealistic hope for cure. Researchers write, the intense daunting nature of these conversations may cause clinicians to resort to learned communication habits or declarative statements. Even a single word may scare patients and families, make them feel disempowered and possibly negate the effectiveness of shared decision making. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.